Hello, my name is Karen. I'm going to be the nurse practitioner examining you today. Can you tell me what brings you here?
I'm doing a physical head-to-toe assessment.
Okay, good. What's your name, your full name?
Anna Chu,
When's your birthday?
May 5th, 1990,
Okay, good. Can you tell me what the date is today?
December 13th, 22.
Yes, good. And who's our current president?
President Biden,
Who was our previous president before him?
Donald Trump,
Okay. And where are you right now?
in a medical clinic.
Okay, good. So patient is alert and oriented times 4. The speech is appropriate for the situation. It's fluent. Now, I'm gonna ask you to remember 3 words, and I'm gonna ask you later on in the exam to tell me what they are, okay?
Mhm.
Ball, green, table.
Ball
Okay,
green table.
ball, green, table. So remember that for me, okay? All right, so now I'm gonna start your examination, okay? So I'm gonna start with your skin. Your skin is normal for ethnicity. There's no swelling, no redness that I can see. Your temperature is warm. Skin turgor is good. All right, so moving on to your head, okay? So I'm gonna look at your head. It's round, normal cephalic. There's your scalp, there's no lesions, no scaling. It looks good. The hair is full and evenly distributed. Regular texture. Yeah, so, all right, let me put on some gloves. Any pain or tenderness when I touch your head? Okay. All right, feeling your temporal artery, palpable +2. Any pain or tenderness?
No.
Okay. The eyebrows are even and symmetric. The eyelids are free from swelling. Medial lateral canthus intact, no swelling. Your sclera is white. The cornea is clear. There's no opacities. Iris is brown and flat in both eyes. Your pupils are centrally located within the iris, +4 bilaterally. Now, can you look down for me? All right, now look up. Okay, bulbar and palpebral conjunctiva are pink. It looks good. I'm gonna palpate for your lacrimal gland, lacrimal sac. Okay, there's no drainage or excessive dryness, no tearing noted, so that's good. Now I'm going to do some eye tests, okay? So we're gonna start with testing your visual acuity. That's innervated by optic nerve, the optic nerve, which is cranial nerve number 2. So we're gonna do that by testing your far and near vision. We're gonna first test your far vision with the Snellen chart. So that's 20 feet in front of you, okay? So I want you to, you're gonna read it for me, but first let me ask you, do you wear any contacts or glasses? Okay, good. So cover one of your eyes. And can you read the smallest line that you can for me?
FGZML,
Okay, good. Now can you cover the other eye and read it backwards?
LMZGM,
Okay, good. Now with both of your eyes open, read it.
FGZML.
Okay, good. So your far vision is good, 20/20. Now we're going to test your near vision. That's with this Rosenbaum chart. You're gonna hold this card 14 inches in front of you. And same thing, cover one of your eyes, smallest line.
LTFPH,
Okay, now cover the other eye, backwards.
HPFTL,
Good. All right, now read it with your eyes open.
LTFPH.
Okay, good. So your visual acuity is 20/20. It looks good. All right. Now, I'm gonna test your cranial nerve number 3, the oculomotor. Okay, so I'm gonna test your pupils for direct and indirect light reflexes. Okay, so I just want you to look straight ahead at the wall for me. Testing direct, indirect, direct, indirect. Okay, good. So your pupils are equal around and reactive to light, both directly and consensually. So now keep looking at the wall and then look at my pen. Okay, now follow my pen as I move it towards your face. Okay, good. So accommodation and convergence is also noted. Okay, so that's good. Now we're going to test your cranial nerves number 3, 4, and 6, oculomotor, trochlear, and abducens. So what I'm gonna have you do is hold still and just follow my pen with your eyes only. Okay, good. So no nystagmus or ptosis is noted, so that's really good. So now I'm going to test your peripheral vision, okay, with the confrontation test. So can you cover one of your eyes for me? So looking at my nose, okay, I want you to tell me how many fingers I'm holding up.
1, 2, 1, 2.
Okay, good. Now the other eye.
1, 2, 1, 2.
Okay, good. So peripheral vision is good. So now I'm going to take a look at the back of your eyes, okay? I'm gonna turn off the light. We're gonna do a fundoscopic exam. Okay, so keep looking at the wall in front of you. I'm gonna come in with my light, okay? All right, red reflex is noted. I'm coming in. Optic disc is orangish yellow in color. Margins, disc margins are sharp. Cup to disc ratio 0.5. Retinal vessels look normal. There's no AV nicking, and the macula is noted. All right, keep looking straight ahead. You're doing good. All right, red reflex is noted. Coming in. Optic disc is yellowish orange in color. Margins are sharp. Cup to disc ratio 0.5. Macula is noted. Retinal vessels look normal. No AV nicking noted. Okay, wonderful. I'm going to turn the lights back on. Okay, so now I'm going to move on to your nose, okay? So I'm going to palpate your frontal sinuses. Any pain or tenderness in your maxillary? No? Okay, good. What about when I palpate your nose? No? Okay, good. So no pain or tenderness noted. Let's see how your patency is. So cover one of your nose, breathe. Other side. Okay, good. So now let's test your sense of smell, okay? That is your olfactory, which is your cranial nerve number 1. I want you to close your eyes, cover one side of your nose, tell me what you smell. Okay, good. Now the other side. Good, okay. Now I'm gonna take a look at the inside of your nose. Okay, can you tilt your head back a little for me? I'm gonna look with my otoscope. All right, so the nasal mucosa is pink and moist. There's no drainage, no bleeding, no erythema, no polyps or ulcers. Same with this side, pink and moist, no polyps, no ulcers, no bleeding, no drainage, no edema. There's no septal deviation or perforation. Okay, now moving on to the mouth. So your lips are pink and moist. Let's check your, let's test your facial nerve, okay? That's your cranial nerve number 7, okay? So can you smile? Okay, can you raise your eyebrows, puff your cheeks? Okay, good, it looks good. Now, can you, let's look at the inside of your mouth, okay? Let's use this. Open your mouth for me. Okay. Dentition is good. There's no gingivitis noted. Say ah. Uvula is at midline. Tonsils noted +1. No exudate though. Hard and soft palate are pink and moist. Buccal mucosa is pink and moist. There's no lesions, no polyps. It looks good. Now, can you stick out your tongue for me? I'm gonna test your cranial nerve number 12, which is the hypoglossal. Stick your tongue out. Okay, it's at midline. Good. Can you move it side to side? Okay, up. Okay, let's take a look. Okay, good. Now I'm going to test your gag reflex, okay, which is innervated by cranial nerves 9 and 10, which is your glossopharyngeal and vagus, okay? It might be a little uncomfortable. I'm gonna put it like towards the back of your mouth, okay? Open your mouth. Okay, gag reflex is noted. Okay, now let's test your cranial nerve number 5, trigeminal. I want you to clench your teeth. I'm gonna try to pull open your mouth by pushing down on your chin. Okay, good. Muscles are strong and symmetrical. All right, now testing the sensory portion of it. I want you to close your eyes. I'm gonna touch your forehead, your cheek, and your chin. Let me know when you feel it.
Down, 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 down.
Good, wonderful. You can open your eyes. Okay, good. So now we're done with the mouth exam, okay? We're gonna move on to your ears. I'm looking at your auricles. The auricles are to the side of each head. It's symmetrical. Any pain or tenderness? What about when I press on your tragus? Mastoid process? No? Good. Okay. So we're gonna test your hearing, okay? So this is your acoustic nerve, okay? Cranial nerve number 8. we're gonna do a few tests, okay? So I want you to first close your eyes. Tell me which side you hear my fingers move. Okay, good, wonderful. You can open your eyes. Now I'm gonna do something called the Weber test, okay? This tests for your any sensory neural or conductive hearing loss. I'm gonna place a tuning fork on top of your head. Let me know if it lateralizes to one side or equal in both sides.
Same.
Okay, good. Now I'm gonna do something called the Renee test. I'm gonna put this on your mastoid process behind your ear. Let me know when you no longer hear it, and I'm gonna move it to the side of your ear and let me know when you no longer hear it.
Stops. Stops.
Same thing.
Stops.
Okay, good. So bone conduction or air conduction is greater than bone conduction, so there's no signs of conductive hearing loss. So that's good. Now, okay, I'm gonna take a look at the inside of your ear. Don't worry, I already changed this. Okay, so pulling your auricle up and back. I'm looking inside your ear. 10% cerumen noted. No erythema. No lesions, no drainage. I see the cone of light at 5 o'clock. The tympanic membrane is pearly gray and intact. Same thing, auricle up and back. 10% cerumen noted also in this ear. No bleeding, no drainage, no discharge, no swelling, no erythema. I see the cone of light at 7 o'clock in this ear. Okay, good. Now, moving on to your neck. The neck is at midline. It's symmetrical. I don't see any lesions. Any pain or tenderness? Okay, good. I'm gonna look at your cervical spine. Okay, it's midline. It looks really good. I'm gonna do some palpation, okay? I'm gonna touch your lymph nodes and let me know if you feel any pain or tenderness, starting with preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular. Any pain or tenderness? Okay, good. Now, your trachea looks like it's at midline. Okay, turn to the side a little for me. Could you do that? Thank you. I'm gonna palpate your thyroid glands. Any pain or tenderness? Okay, good. It doesn't feel enlarged. Can you swallow for me? Okay, good. Thyroid glands are good. There's no enlargement or swelling. Okay, so now let's examine your chest, okay? Can you just lower this a little? Okay, good. So just breathe normally. Respirations look even, unlabored, regular. No retractions or bulging noted. I don't see any lesions or masses. Do you have any pain or tenderness when I palpate the anterior chest? Okay, good. So I'm gonna assess the back of your chest first, okay? So can you just turn and face that wall? Thank you. Looking at the back of your chest, no masses or lesions noted. Do you have any pain or tenderness?
No.
Can you take a deep breath? Okay, lung expansion is symmetrical. I'm going to percuss, okay? It should sound resonant in all fields. Okay, good. So resonance is noted in all fields. Let's test for diaphragmatic exertion. What I want you to do here is exhale for me and hold. Resonant, 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 dull. Okay, now take a deep breath and hold. Resonant, 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 dull. Okay, so it's about 5 centimeters, which is normal, okay? Now I'm gonna do something called tactile fremidus. I want you to repeat 99 when you feel my palms on your back.
99, 99, 99, 99.
Okay, vibrations are symmetric on both sides, so that's good. Now I'm going to have a listen at your lungs. When you feel my stethoscope, just take deep breaths in and out, okay? Okay, lung sounds are clear to auscultation bilaterally. I heard bronchovesicular lung sounds between the first and second intercostal spaces, vesicular lung sounds at the bases and most of the lungs. Now, we're going to test for egophony. You're gonna repeat E, and I'm placing my stethoscope on your back.
E, 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 E,
Okay, it sounds like E and not A, no evidence of consolidation. Now we're gonna do the whispered pectoraliquy test. You're gonna whisper 1, 2, 3 now. Okay, good. It's inaudible. I can't hear it, and that's normal. There's no evidence of consolidation. Now, looking at the front of your chest again, like I said, I don't see any masses or lesions. There's no pain on palpation. Let's have you lay down. Let me move this along. Let me move this up a little bit so it's not so uncomfortable. Lay down. I'm going to percuss, okay? And let's move this in. Okay, so we're gonna start with percussion again. It should sound resonant. Okay, it sounds resonant in all fields. Good. Now listen. So same thing, deep breaths in and out. Okay, good. So it sounds clear in all fields, so that's really good. So now, while I have you lay down, I'm just going to, I'm going to examine your heart, okay? So let's do that first. I'm gonna listen to your heart, okay, with my, the diaphragm and the bell of my stethoscope, okay? You could just breathe normally for this. So starting with the aortic valve on the second intercostal space, right sternal border. Now I'm listening to the pulmonic valve in your second intercostal space, left sternal border. All right, now I'm gonna listen to the tricuspid valve, which is fourth intercostal space, left sternal border. Now your mitral valve, which is at the left midclavicular line, fifth intercostal space. Okay, listening to it with my bell, same landmarks, aortic valve, pulmonic valve, your tricuspid, and the mitral. Okay, it sounds good. S1, S2 heard no murmurs, rubs, or gallops. So let's feel. I'm taking a look at your neck. I see a visible jugular venous pulsation, but it doesn't look distended. I'm gonna palpate your carotid pulse. Okay, +2 bilaterally, no thrills or heaves. That's good. Let's measure your jugular, for jugular venous distension. I'm sorry. So measuring, turn to your left a little. So I'm going to the top of where I see the pulsation. Okay. It's at about 2 centimeters, which is normal, okay? There's no distension noted, so that's really good. Now, if you don't mind, I'm gonna have you sit up, okay? All right. So I'm going to listen to your heart again with my stethoscope, both the diaphragm and the bell. Same landmarks, the aortic valve, pulmonic valve, tricuspid valve, mitral valve. Okay, now with the bell. Okay, good. Now, can you lean forward a little for me? I'm gonna listen to your mitral valve again with my diaphragm and with my bell. Okay, S1, S2 heard, no rubs, no murmurs, no gallops. Sounds normal. Now I'm going to test, check your blood pressure and your heart rate. Okay, let's put this on your finger. Up, thank you. Heart rate 78, SpO2 98 on room air, good. Okay, 118/78, which is good, that's normal. Okay, oh, you know what, let me do one more thing. I'm gonna check to see if there's any pulse deficits, okay? So I'm gonna palpate your radial artery and listen to your heart. Okay, no pulse deficit noted. Okay, now let's do a vest. Like looking at your upper and lower extremities, there's no cyanosis, no clubbing of the fingers, capillary refill is less than 3, extremities are warm, capillary refill less than 3. All right, it's good. While I'm down here, I'm gonna check your dorsalis pedis pulse. Okay, +2 on both sides and your posterior tibial. Good, +2 on both sides, your radial. +2 on both sides, brachial. +2, okay, good. Now I'm going to have you lay down for me again, okay? Okay, and then there's one more thing that I have to do with cardiac. I just want to test for your apical impulse, okay? Can you just turn slightly laterally to the side for me? Good, okay. So it should be felt at the left left side mid-clavicular line around the fifth intercostal space. And the apical impulse is noted, okay? I feel it. It's good. I'm going to lift your gown up a little. I'm just gonna check your femoral artery, okay? Okay, good. Palpable +2. Okay, let's put your gown down. And if you don't mind, I'm going to have you, can we pull your gown down so I can assess your abdomen? Okay. I want to listen to see if there's any bruits first, okay? So I'm going to listen to your carotid. Aorta. The right femoral artery, left femoral artery, right iliac crest, left iliac crest. Okay, I don't hear any bruits, okay, it's good. Now, looking at your abdomen, it's soft, non-distended. I don't see any masses or lesions. I don't see a visible aortic pulsation. Let's have a listen at your bowel sounds. I'm starting from the right lower quadrant and moving up to the side. Okay, bowel sounds are present in all fields. Now I'm gonna percuss. It should sound timpani. Okay, yeah, timpani in all sides. Let's measure your liver span. Okay, so I'm gonna go from up, down, and then down, up. Okay. Okay, so the liver span measures about 7 centimeters, which is normal. Now I'm going to percuss for your spleen at the left anterior axillary line. I want you to exhale all the way. Now take a deep breath in and out. Okay, so it sounded tympanitic as I was doing that, which is good. If there's any dullness, it could be a sign of splenomegaly. Now I'm gonna do some palpation, okay? Let me know, some light and deep palpation. Let me know if you have any pain or tenderness. Okay, now deep. Any pain or, okay, good. Now I'm gonna palpate for your liver, which is at the right upper quadrant. Can you breathe in? Okay, breathe out. Okay, I can't feel your liver, which is normal. Now your spleen, it's not palpable. Okay, so no signs of like enlarged spleen or liver, so that's good. Now, can you sit up for me, please? Okay, so let me come to this side. I'm going to check to see if you have any signs of kidney infection, okay? So I'm gonna do the punch test at the costovertebral angle. Can you just turn to the right side of the wall? Thank you, okay. I'm gonna tap on your back, okay? Let me know if you have any pain when I do that.
Yeah.
Okay, now this side.
No.
Okay, good, so no signs of infection, that's good. All right, so now let's get up and move around, shall we? All right. So just take a walk for me normally. Okay, good. So the posture is upright. The gait is good and steady. Can you turn towards that wall for me? I'm looking at the side, your spine from the side view. There's an S curvature noted from the side, which is good. Now the back, are you able to bend forward? Okay, good. Okay, any pain or tenderness? Okay, stand up. So no pain or tenderness when I palpate the spine and the paraspinal muscles, which is good. I don't see any signs of scoliosis or kyphosis. Can you bend, rotate your hips? Okay, bend down and back. Okay, full range of motion, good. Now let's, you can look at me, let's test your joints, okay? So your TMJ, temporomandibular joint. So I'm gonna feel it, any pain or tenderness? Open your mouth as wide as possible. Okay, no audible click, that's good. Now your shoulders, any pain or tenderness? All right, let's test your spinal accessory nerve, okay, cranial nerve number 11. Can you try to push up, turn your head against the resistance of my hand? Okay, the other way, good. Shrug your shoulders. Good, okay, very strong. So now can you raise your hand in front of you, behind you, to the side, across? Okay, good. Any pain or tenderness in your elbow? What about your wrists and your fingers and hands? Okay, can you bend your elbows and straighten them? Okay, good. Palms down and up. Okay, good. Fist. Okay, spread your fingers. Okay, touch each finger with your thumb. Good, okay, full range of motion, good. Any pain or tenderness in your knees? No? Okay, good. Can you bend them? Okay, good. Pain or tenderness around your ankles?
No.
What about your feet?
No.
Your toes?
No.
No? Okay. Can you sit down for me for a second? Can you try to lift your knee up against resistance, this side? Okay, good. Try to push on my hands. Okay, pull. Okay, good. You're very strong. Okay. Now try to push my hands. Okay, good. Now try to pull my arms. Okay, good. Very strong. So 5 out of 5 muscle strength, upper and lower extremities. Now let's test your balance and coordination. Can I have you stand against this wall? I'm gonna stand in front of you for safety, okay? So I want you to close your eyes. We're gonna test for upper extremity motor drift. Lift your arms in front of you, but with your palms up. Okay, good. No swing noted. Balance looks good. Now let's do something called the Romberg test. You're gonna close your eyes. This is gonna have to be for about 15 seconds. I'm gonna see if you have any swing or loss of balance. Okay, it's been 15 seconds. There's no swing, no balance issues there. Everything looks good. Can you come over here? And we're gonna do something called a heel toe walk, okay? So you're gonna walk like this with your heel in front of your toes and try to do it in a straight line. Good, okay, now can you walk back this way on your toes? Heels? Okay, perfect, it looks good. Now I'm gonna have you have a seat again, okay? Okay, can you, are you able to move your heel down your shin? Heel down your shin, yep, and the other side? Good, okay. Now I want you to touch my finger and then touch your nose. I'm gonna be moving my finger around, okay? So touch my finger, touch your nose. Good, okay, so balance and coordination looks good, everything looks really good. So now we're going to test for any sensory deficits, okay? So I'm going to do light touch first. I'm gonna have you close your eyes, tell me where you feel me touching you.
Left cheek. Right arm. Left arm. Right foot. Left foot.
Good, okay. Now we're gonna do something called a sharp and dull test, okay? You can look. So this is sharp, this is dull, okay? All right, so let me know when you feel it, okay? If it's sharp, dull.
Sharp. Dull. Sharp. Dull.
Okay, good. You can open your eyes. Well, actually close your eyes again. We're gonna do a stereognosis test, okay? I'm gonna put an object in your hand and you tell me what it is. Okay, good. Now you can keep your eyes closed still. I'm going to place a tuning fork, a vibrating tuning fork, on a body part, okay? Let me know if you feel the vibrations and where it is.
Right wrist. Left elbow. Right ankle. Left ankle.
Good, okay. That looks really good. All right. Now the last test I'm gonna do is, I'm gonna test your reflexes, okay? So, I'm gonna test your, your biceps first, so, can you flex? Okay, now relax. Okay, good. Now this side, flex, relax. Okay, good. Now the triceps, can you, pull your arm out like this, and I'm gonna hold on to it. You could relax your arm, okay? Okay. Now same for this side. Arm out. Relax your arm. Okay, good. Put your gown back on. Okay. Now I'm gonna test your brachial radial. Okay, good. Now your patella, you could move towards the edge for me. Good. Now relax your legs. Okay, good. Now your Achilles. Okay, good. Now last thing is the Babinski, okay? I'm gonna touch the bottom of your foot. Okay, no curling or fanning of the toes, so it looks good. Everything looks really good today, okay? So I'll see you back in about a year for your next exam.